Bismillah. Assalamu alaikum wa rahmatullahi wa barakatuh. Today my subject is about teratogenicity. I am Zaina Hamid Habbosh. Let's begin. Teratogenicity is the ability to cause developmental abnormalities in the fetus. I have two terms to talk about. Congenital malformations. It is the non-reversible functional or morphological defects present at birth. And teratology is the study of abnormalities of physiological development. Teratology history. The principles were added by Jim Wilson in 1950, and in 1960 David Smith in University of Washington popularized the term teratology, and in 2015 teratology overlaps with the other field of science, the developmental biology, embryology, and genetics. Teratogene is the agent that can disturb the development of the embryo or fetus. Teratogenes halt the pregnancy or produce congenital malformations. The classes of it is radiation, maternal infection, chemicals, or drugs. Causes of malformations: 40% are unknown, 20 to 25 genetic defects, 20 interaction between hereditary factors and environmental factors, maternal illness, X-ray, chemicals, and drugs. Environmental factors, as the maternal diseases as diabetes and seizure disorders, infections as rubella. Rubella can result in a group of defects including heart disease, cataracts, and deafness, known as fetal rubella syndrome. Chemical and drugs, only a small portion are due to drugs acting as teratogens. Risk factors of teratogenicity. There is no way to predict drug exposures that result in teratogenesis. The effects of many drugs on animal development are not applicable to human pregnancies. Several factors determine that teratogenic effects of drugs on the fetus during pregnancy. And the factors to determine that is the dose reaching to fetus, duration of exposure, point in development when drug exposure occurs, environmental factors as age, disease of the mother. FDA classified the drug risks in that animal studies that cannot be true predictors of the teratogenicity due to wide inter- and intraspecies variations in the pharmacokinetics properties of the drugs, including placental transfer. Only controlled epidemiological studies can detect a relationship between environmental factors such as drug exposure and pregnancy outcomes. Um, to know everything about the fetus, we're talking here about the organogenesis. It is a period from week 4 to week 10 referred to it. The remainder of first trimester. It is the most critical time of organ malformation. Drugs that reach the embryo at this point may produce none or at all effect, an anatomic defect, teratogenesis, or a metabolic or functional defect that may not be detected until later in life. The fetogenesis, the fetal stage, is the second and third trimester. Drugs are not associated with the major malformations, but they may influence neurologic development, growth, physiological and biochemical functioning, mental development, and reproduction. Little is known about the exact time of the greatest risk for teratogenesis. An exception is the thalidomide, which has been shown most harmful during the days 34 to 50 to 65, 56 of gestation. Effects as fatal alcohol syndrome. This group of defects is seen in mothers with high dose of alcohol intake during their pregnancies. Common defects are perinatal and postnatal growth, retardation, mental retardation, poor coordination, hypotonia, hyperactivity, microphaly, short upturned nose, micrognathia or retrognathia in infancy, short palpebral fissures, hypoplastic filarium. As for the fatal warfarin syndrome, this type of defect took place due to exposure to coumarins. Exposure to coumarins causes optic atrophy, cataracts, mental retardation, microcephaly, deafness, growth retardation, scoliosis, which is a curvature of the spine, seizures, and hemorrhage. The fatal hydantoin syndrome occurs due to overuse of phenytoin, consisting of intrauterine growth retardation, microcephaly, mental retardation, distal phalangeal hyperplasia, and specific facial features. A drug risk category. No fetal risk shown in controlled human studies in all trimesters. Possibility of harm to fetus is remote. Animal studies show a risk that is not confirmed in human studies during all trimesters. Fetal risk shown in controlled animal studies but not controlled human studies are available, or studies in humans and animals are not available. Studies showed fetal risk in humans. Use of a drug may be acceptable even with risks, such as in life-threatening illness, or where safer drugs cannot be used or are ineffective. Risk to fetus clearly outweighs any benefits from these drugs. The drug is contraindicated in women who are or may become pregnant. As for the known teratogens and their effects, we're talking here about aminoglycosides in high doses. It causes cranial nerve damage. Androgens causes masculinization of female fetus. ACE inhibitors, renal tubular dysplasia, skull hypoplasia, oligohydramines, pulmonary hypoplasia, antioplastic alkylating agents causes growth retardation, microphthalmia, cloudy cornea, agenesis of kidney, cardiac defects, antimetabolite agents, growth retardation, malformation of ear, eye, nose, cleft palate, malformation of extremities, fingers, brain, skull. As for carbamazepine, craniofacial abnormalities, growth retardation, neural tube defects, fingernail hypoplasia. Cocaine, premature birth, abrupt placenta, prenatal morbidity, growth retardation, stroke, bowel atresis, defects of genitourinary system, heart, limb, and face. As for the iodides, goiter and fetal hypothyroidism are shown, lithium Epstein anomaly, tetracyclines, weakened fetal bones, and tooth enamel dysplasia, permanent tooth discoloration. For the retinoids, isotretinoin cause heart defects, spontaneous abortion. Micratia is a small external ears. Microcephalus, hydrocephalus, cognitive defects. Vitamin A, micratia, craniofacial, CNS, and cardiac anomalies, bowel atresia, limb reductions, urinary tract defects. Thalidomide, as we spoke before, the first known drug teratogene, a sedative, non-nauseating, non-barbiturate, greatest danger drug during days from 34 to 56 of pregnancy. It was clarified in 1939. Sorry, 1993. 93. Valproic acid causes spina bifida, a neural tube defect, facial anomalies with slow development. And that's it. Thank you for your patience and for your listening.